Hello, everyone. I'm Mary Jane Esplen, and I'm a psycho-oncologist. I'm a therapist, and I've actually worked for quite a few decades now in psychosocial oncology research. And I just want to point out a couple of things because I can't be at the conference speaking this year, but I am involved in PRAIN, and I think it's excellent, the program that they have lined up. But I want to speak specifically to the concerns that young adults have with colorectal cancer or following colorectal cancer in the psychosocial oncology arena, because it's so important. First of all, and you may or may not be aware of this, whether or not you've ever had a mental health background, anyone coming to this situation, dealing with such a life-threatening, life-altering kind of diagnosis, even when the prognosis is good, there can be emotional concerns. In fact, anywhere from 30 to up to 84, 90% of young adults will describe emotional concerns along the line of anxiety, sadness, loss of interest in some ways in their daily activity, changes in body image, changes in a sense of who they are or their roles, a sense of identity. And by the way, one of the most common symptoms to deal with is fatigue. Now, one of the things I always say is every single thing we do to patients in treatment, because we all want treatments, but all of our treatments, so surgery, radiation, chemotherapy, hormonal type therapies, all of them have an impact on the person and the body. So even when you're coping well, there will be some residual impacts, as well as just getting through the treatments, getting through the surgeries, dealing with this within families. So we know there are understandably stressors, and because there are stressors, everyone to some extent will have psychosocial impacts, and you'll, whether you wanted to or not, are confronted in having to cope with this illness, unfortunately. So what I want to just put out there is that all cancer programs now in Canada, large or small, should have at least one person, if not several people involved, to provide psychosocial care. And I know it can be difficult to speak up about because of stigma, and we're really hoping nurses and physicians are checking in with patients in all of the follow-ups during the treatment periods and so forth. But let us know when you could use some help, because it doesn't mean you're weak. It doesn't mean you're not coping necessarily. It's just that this is such an understandable, challenging illness. And in fact, psychosocial oncology, or the psychosocial impact, is integral now into all of cancer care, including the survivorship period. The other thing I want to just put out there is not only does it impact on the person themselves or their own coping, but the spouses or partners and children. So there can be all kinds of other impacts, everything from physical impacts like fatigue, from the stress, or the hormonal or other types of treatments, or the chemotherapy impacts. There can be cognitive impacts for the person. There can be body image and sexual functioning impacts. So I'll just put out there to try to let your nurses know, or your physicians at any point in your journey, that you would like to speak to someone, and they will make a referral. I just want to encourage you to attend the symposium. It's an excellent lineup on October 26th and 27th. CCRAN is an excellent organization and very much focused on patient and family care and making sure that individuals and their families have the services that they need. Enjoy the conference.